50-ish-year-old man who came in for a chronic issue follow-up. He brought his wife with him this time around. At the end of the visit, she says, "Hey, tell the doc about that thing you can do." He turns to me proudly and tells me that he can whistle from his penis. If he really pushed, he could blow gas from it. His wife insisted it wasn't normal, but he was certain most guys could. Turns out, he had a connection between his bowel and his bladder. A younger gal who had come in for generalized abdominal pain that she experienced on and off for years, but just always wrote off to either menstrual cramps or bad food or life. We had asked her if her bowel movements were regular, and she said yes. At some point, someone was sharp enough to ask her how often she had bowel movements, to which she said about once every 2 to 3 weeks. She had been suffering from pretty severe constipation, but just thought it was normal to have BMs once to twice a month. From the other side of the therapy couch as a client, I once described a new emotion I was feeling that was really difficult to process. Turns out I was just fully experiencing sadness. I'd built a defense mechanism where I'd go straight from zero to angry, and whatever was trying to make me sad I'd just get angry about instead. So I'd never really spent time in the sadness area long enough to experience it properly. It usually flicked me straight through to anger at high speed. I can't imagine what it's like as a therapist to have a 33-year-old telling you about this weird new feeling, and you having to explain to them what a normal response sadness is. I was the patient, but when I went in for a routine physical the doctor poked my extended belly and asked how long it had been like that. I laughed and said, "What? My bare belly? Oh, since I was 21 probably." Turned out that, no, the beer belly was a cyst that had grown really large and that was why my friends kept saying I looked pregnant. I thought I just had really bad friends. Had to have emergency surgery and for a week or so they did not know if it was a cyst or ovarian cancer. It was a pretty big scare. This was a time I was told something I did wasn't normal. I was in physical therapy recovering from a back surgery. My in-home physical therapist was having me do stretches and asked me to extend my leg as far as possible and straighten my knee. So I do this and my knee inverts, which to me was totally normal, but my physical therapist was very surprised. She explained that it was very abnormal and she had not seen hyperflexible knees like mine before. So now I know my wonky bird knees are not normal. 95-year-old veteran 5 years in remission from kidney cancer. Came in with 72-years-old wife for routine follow-up. She wants to know if it's safe to have sex every day because she is worried about his health. Yup. 95 years old. Has sex every day. No Viagra. We just said, congratulations. Yes, sex every day is very good for your reproductive tract, penis or vagina. It keeps blood flow going and helps you maintain function of your bits for as long as possible. Use it or lose it, essentially. And it doesn't have to be with someone else, either. I was the patient. I had no idea that it wasn't normal to uncontrollably sob for 2 weeks out of every month, have breasts so sore I couldn't go downstairs, because of the jiggle. And then have it all stop the day you start your period. It took me getting a female roommate at 30 for me to realize that wasn't typical. I asked my gynecologist after charting my symptoms for 6 months. PMDD, a depressive disorder that is tied to your menstruation. A change in birth control pills fixed it right up. He also looked at me like I was crazy for thinking that was normal for 16 years. I asked my mom after my diagnosis, "Oh yeah. Remember in high school? Your friends would come over and ask if you were crazy that day or not?" "No mom. They didn't ask me that. Thanks for letting me know." Guy in his 20s came in complaining of belly button problem. I examined him. He had an irritated scab inside the belly button caused by aggressive lint picking. But dude was sweaty and had a slight tremor. Looked like crap. When I asked how he was feeling overall he said, "Oh, okay I guess. Just a little tired, drank a little more this week than usual. Probably overdid it." I had to pry for details and turns out he drank a gallon of gin over the last 3 days, and stopped drinking alcohol when he started vomiting large amounts of blood, and pooping a mixture of bright red blood and dark sticky stuff, melena digested blood. He was totally unaware of the fact that he was going through alcohol withdrawal, sweating, shaking, because he hadn't stopped drinking long enough in recent memory to experience symptoms. I sent him straight to the emergency room, where they found a tear in his esophagus that required immediate intervention, and he was admitted for inpatient alcohol detox. I read his hospital note. He still insisted that the doc examine his belly button. Not a doctor, but when I was maybe 14 or 13, I remember describing to my primary, how during my periods I would pass out from the pain. Couldn't move or I would get sick, and told her a story about how I went on a trip to Italy, and sometime in the middle of the flight became wildly sick to the point of terrifying the poor flight attendants. I'm so sorry, flight attendants. I was filling 4 puke bags, crawling to the back of the plane clutching my stomach, finding the doors locked attempting to use the first-class bathrooms so I could finish being sick, when denied entry just lay down in the aisle waiting for sweet death to take me. It did not. Death has terrible customer service. I then passed out when we exited the plane. But periods are supposed to be painful, right? The doctor was like, honey, you're supposed to experience some discomfort, not be incapacitated anyway. She put me on birth control and I've never been happier. I feel like my story belongs here even though I'm the patient. A few years back my mental health totally took a skydive. As a result I dropped out of school and had to start a recovery program. The first thing I had to do was talk to a psychologist. During these conversations with the psychologist, she'd focus on different parts of my life. So one day she'd ask about relationships and the next, childhood memories and so on. After a few conversations she focused on my social life. I then told her that it's pretty much non-existent, and it always has been. She then stated that I must have suffered from loneliness a lot then. I just told her that I've never actually felt lonely at any point in my life. After all, it's pretty hard to feel lonely with the 2 voices in your head always keeping conversation. But surely she knew that, right? Well, as it turns out, no. Apparently everybody else only have their own voice in their head. My entire life has been a lie. Turns out I'm schizophrenic. Who would have thought that? Not a doctor, but I had an experience with someone I slept with. We had just finished and were cuddling when he remarked that he was happy he felt like he was in his body. I looked at him funny and asked him what he meant, and he said, you know that funny feeling you get after sex where you feel like you're not in your body? You're like looking at yourself from the opposite side of the room? Well, right now I don't feel like that, I feel happy instead. I tried my best to not look horrified and I asked him if it was always like that for him. He explained to me that it only started happening after something awful happened to him 2 years ago. I had to do my best to gently explain that, no, I do not get that funny feeling and most people don't. I also had to explain, to the best of non-professional capacity, what disassociation was. I woke up with a period so heavy the bed was soaked. Stood up and it just poured out of me, clots the size of my palm. Overwhelmed, I did what any woman would do, if they could, and phoned my mom to come over and comfort me, and help me clean up the mess. At this point I was still thinking, this is a strangely heavy period. And I was more worried about how my landlord would react to the carpet. I then fainted, woke up, fainted again, phoned mom to cry about my stupid period making me miss work. My parents called an ambulance that arrived to the house first and rushed me to hospital. Not period. Massive internal hemorrhage in the womb. I'm a patient. Growing up I assumed I was struggling in school because I was just a stupid miserable loser. I had zero confidence in myself or anyone else. Sometimes I would go days without sleeping, other times I would sleep all day. I thought about my own death constantly. I truly believed that I was a flawed person and that it would always be that way. Turns out I actually have bipolar disorder. And thanks to medications and therapy, I am a normal functioning human now. I was the patient. When I was growing up, I had constant stomach aches. Every time I ate, I'd get sick. I went to the doctor multiple times for it, but they could never figure out what was wrong. Eventually, I started to think that everyone lives with pain like that, and I was just being a wimp and couldn't deal with it. I barely ate, such that I was super underweight. I was miserable all the time. I was constantly stressed and depressed because of this problem. Fast forward to grad school. My first year is in China. I'm there for a few months and then, over time, my symptoms disappear. I don't have stomach aches anymore. I gain about 40 pounds seemingly overnight. Now I'm at a healthy, doctor-approved weight. My depressive symptoms disappear almost entirely. But how could that happen? What could have caused such a change? Turns out, I'm lactose intolerant. I grew up in the Midwest where pretty much everything has dairy in it and I'd been eating it constantly for so long, it took months for my system to reset. Being in China where dairy isn't such a staple made all the difference. I felt like such an idiot when I realized that was what was making me ill. On the plus side, I feel better, look better, and am a much happier person now. I was the patient, but mine was kind of backwards of the whole thing. I feel like it's close enough to fit. When I lie down on my back, My feet turn out lay completely flat. They've always done this, my bones in my legs are twisted and that's the most comfortable position for them. This was the day after I broke my pelvis and I was going to the doctors to see what the damage was. The doctor didn't know about my feet, so he had this terrified look on his face when he saw me and headed back out. My mom had to talk to him and tell him no, that was normal because he assumed I broke both hips. I'm a doc. It's about me. In my psych rotation, me and my fellow students were interviewing this anhedonic patient. A guy asked him, does it feel like nothing matters and that you'd rather die? I promptly responded, of course, but that's just normal. Thinking about death because there's so many bad things in the world that we know for sure are happening but have no actual way of subverting or preventing. In my mind, scenes of forced prostitution, organ harvesting, domestic abuse, serial rape, sadistic torture. They just all collectively said, no. That's not normal. If you're having problems, please tell us more. I just responded, oh. And justified in my head that it's just a lack of proper communication. Had a patient come into triage and write on the sheet, my doctor sent me over. Why? Because she told them last week that she was having to hold her right eye shut to watch TV because it would stare off to the side. She got a MRI with a 4 cm brain mass and then waited 4 days at home after her doctor called her before coming to the ED because she didn't think it was an emergency. Upon eliciting a history, she lost most of vision in her right eye about 3 months prior, and only mentioned to her OB when she lost control of motor function of her right eye. When I asked why she didn't mention it earlier, she said, well, I know it's normal to just sometimes lose your vision in pregnancy. Turns out, she had an estrogen-sensitive brain tumor that likely grew every time she was pregnant, and compressed part of her optic nerve and then regressed after she delivered. But no ma'am, it is not normal to go half-blind when you're pregnant. That's not in what to expect when you're expecting. Oh. Or my lady who came into triage with an estimated due date of like 2 months ago, so approximately 48 weeks pregnant, who said she had contractions. No prenatal care, and had never seen contractions. I go in to see her and I ask, tell me about your contractions, and she said, well, I'm not really sure but I can't move my legs so I assume that's labor. I'm not in pain though. Turns out, not pregnant. BHCG, pregnancy hormone, secreting ovarian tumor that made her look pregnant, and she presented with metastatic disease to the spine that paralyzed her from the waist down.